Hello everyone, we are from small group discussion B7 and now we will present about MDR-TB. First, let me introduce myself. My name is Tiffany Cecilia with 3 last digit number 170. So here is the outline. First is introduction, consists of background information, problem identifications, objectives, and benefits. Second is content, consists of definition, epidemiology, etiology, pathophysiology, clinical manifestations, diagnosis, treatment and management, complications, and prognosis. The last is summary, consists of conclusions and suggestions.
Chapter 1 Introduction. Hello everyone, my name is Fricillia Wijaya with last digit name 236 and I will explain the chapter 1 introductions. 1.1 Background. So multi-drug resistant tuberculosis or MDR-TB refers to a variant of tuberculosis, and tuberculosis stemming from Mycobacterium tuberculosis is an infectious ailment with far-reaching health consequences. It stands as a significant contributor to poor health, ranking among the top 10 causes of death on global scale. Remarkably, TB surpasses even HIV/AIDS as a primary cause of death resulting from a single infectious agent. Based on the urgency that has been explained, it is very important to understand multi-drug resistant tuberculosis. Therefore, we compiled this literature to increase the understandings of multi-drug resistant tuberculosis or MDR-TB and help to reduce the high morbidity and mortality that it causes. 1.2 Problem formulations. There are in total 9 of problem formulation that will be answered in 1.3 objectives, so there are in total 9 also. And the last one is 1.4 benefits. So the benefits of running the student project is to enhance the knowledge and understandings of multi-drug resistant tuberculosis or MDR-TB. And in addition, the student project is also expected to be a reference for another research related to multi-drug resistant tuberculosis or MDR-TB. That's all from me, and the next one will be explained by my friend. Thank you.
Hello, my name is Dea Kalista Adana Putri with 3 last digit number 1 to 9 and I will present you about the definition of multi-drug resistance tuberculosis. Tuberculosis TB is one of the epidemics that highly threatens global public health and causes even more deaths each year than any other bacterial infection. It's a lethal airborne infection caused by Mycobacterium tuberculosis, which continues to evolve to resist the antagonist drugs and led to the outbreak of resistant strain that gave rise to multi-drug resistant tuberculosis. The World Health Organization has defined multi-drug resistance TB or MDR-TB as TB that shows resistance to both azonicide and rifampicin, the most effective anti-TB drugs.
Hello, my name is Fernando Ghosali and my last digit of student number is 036. Now I'll explain about the epidemiology of MDR-TB. According to the World Health Organization, in 2020, there were an estimated 465,000 new cases of MDR-TB worldwide. Additionally, there were about 182,000 deaths attributable to MDR-TB, making it a deadly variant of the disease. The prevalence of MDR-TB varies across different regions, with the highest burden found in parts of Eastern Europe, Central Asia, and parts of Africa. Southeast Asia had an estimated 182,000 new cases of MDR-TB, accounting for approximately 39% of the global burden. Among the countries in this region, Indonesia, with its large population, contributes significantly to the overall prevalence of MDR-TB. Indonesia is estimated to have more than 20,000 new cases of MDR-TB annually, making it one of the top MDR-TB burden countries worldwide. That's all from me. Thank you.
Okay, greetings to doctors and friends. My name is Abel Immanuel Sianipar with the last digit of student number 118. So I'll be explaining to you guys about the etiology of multi-drug resistance TB. So this disease poses a critical global health challenge due to its resistance to first-line TB drugs, which are pivotal in TB treatment. Genetic mutations in specific genes such as RPOB and CATG contribute significantly to MDR-TB's emergence. These mutations impair the efficacy of essential first-line drugs like isoniazid and rifampicin, rendering them ineffective against Mycobacterium tuberculosis. Additionally, sociodemographic factors and healthcare systems weaknesses contribute to MDR-TB's prevalence. Studies in South Africa emphasize the impact of patients' demographic and adherence to treatment regimens, highlighting their crucial role in MDR-TB's etiology and in MDR-TB's etiology. Okay, so that's all from me. Thank you very much.
Hello everyone, my name is Fiona Nathanael Santoso with my last 3-digit study number ID R249. The pathophysiology of MDR-TB has several complex and diverse mechanisms. From the first mechanism is human error, and there are two factors. The first one is primary resistance, which occurs when individuals are infected with strains that are already resistant to drugs, and typically it occurs in communities with high burden of MDR-TB cases. And the second one is acquired resistance, which occurs when a person infected with a strain that was initially susceptible to a drug does not get adequate treatment or does not adhere to the treatment that given. As a result, there are genetic changes or mutations in the Mycobacterium tuberculosis, making it resistant to the drug use. And the genes involved in the mutation can be seen on the screen. And the next mechanism is intrinsic pathway, such as cell envelope and efflux pumps of the drugs. The permeability of cell wall works as an essential defense mechanism to prevent harmful substance from penetrating to the cell wall and causing harmful effects. So if there's any defect in the cell wall, it can weaken the defense system and making organism more susceptible to the detrimental effects of various antimicrobial drugs. And the next one is efflux pump. The efflux pump transport many drugs molecules out of the cell, and there are many pumps that transport a diverse range of structurally dissimilar substrates and are known as multi-drug resistance or MDR efflux pumps. And whenever it overexpressed, the major Fasilitator superfamily or MFS pumps will contribute to clinically significant levels of MDR and export a wide range of substrates. And that's all about the pathophysiology. The next explanation will be presented by my friend. Thank you.
So hi everyone, my name is Khadra from Kamila with last year's number 009. I would like to explain about the clinical manifestations of MDR-TB. The clinical manifestations of MDR-TB are actually not much different from the symptoms of TB in general. However, the symptom experience tend to worsen and last longer. There are several symptoms of MDR-TB in general, such as a persistent cough that lasts more than 3 weeks, cough accompanied by yellow, green, or bloody mucus, hemoptysis, shortness of breath, fever, sweating at night, weight loss, weakness or fatigue, chest pain, loss of appetite, and in children, coughing and wheezing that lasts more than 2 weeks. The clinical manifestations of MDR-TB in other parts of the body depend on which area affected. So that's all from me. Next slide will be explained by my colleague. Thank you.
Hello doctors and friends, my name is Jovita Theodora Liu with last 3 digits 114. Now I will explain to you about the diagnosis. Multi-drug resistant tuberculosis or MDR-TB can be diagnosed through many methods such as culture-based method, molecular-based method, and the gene export MTBRIF assay. The gold standard for diagnosing MDR-TB is the culture-based method. This method uses solid and liquid culture to grow Mycobacterium tuberculosis from a clinical sample such as sputum, pleural fluid, urine, pus, cerebrospinal fluid, etc. The World Health Organization has recommended the gene export MTBRIF assay as a test to detect tuberculosis and at the same time detect rifampicin resistance. This method tests directly on sputum and detects 99% of smear-positive patients and 80% of patients with smear-negative patients. Another method that can help to diagnose MDR-TB is imaging. Imaging can help localize sites of the disease and get aspiration or biopsy for microbiological and molecular examination. The imaging that can be used is CT scan chest. That's all from me. Thank you.
Now, we will move to the 2.7, which is the treatment and management. First of all, my name is Nathanael Dihardja with the last 3 digits of my student's number R16. Treating multi-drug resistant tuberculosis or MDR-TB is a complex process that requires specialized medical care. MDR-TB occurs when tuberculosis germs resist multiple medications, which complicate the treatment. To manage the MDR, drug susceptibility testing or DST helps to identify effective and better medications.
while individual treatment regimens typically include at least 5 potent TB drugs and multipotent TB drugs, like levofloxacin and moxifloxacin. Treatment is divided into the intensive phase, which lasts up to 3 or 4 months, and continuation phases lasting up to the 24 months, with drug choice based on the DST results and patient response, which aim to cure the patient and prevent further spread of the disease.
Thank you so much for the time. My name is Dihardja right now with teacher number 78, and I will tell you about the complications of MDR-TB. So one of the most concerning complications of MDR-TB is the prolonged and arduous treatment regimen. Patients diagnosed with MDR-TB require a more extended and complex treatment course compared to drug-sensitive TB, often lasting up to 2 years or more. This extended treatment duration poses several challenges during medication adherence, increased healthcare costs, and potential side effects from second-line drugs used in MDR-TB treatment. Furthermore, MDR-TB is associated with significantly higher mortality rates compared to drug-sensitive TB. A study reported that MDR-TB patients face a higher risk of death, with only 50% survival at 2 years after diagnosis. This heightened mortality risk is attributed to the limited efficacy of second-line drugs, their increased toxicity, and the delay in diagnosis and initiation of appropriate treatment. In addition to this direct impact on patients, MDR-TB also poses a public health threat due to its potential for transmission. Patients with MDR-TB are contagious, and if left untreated, they can transmit the drug-resistant strain to others, potentially leading to the emergence of excessively drug-resistant TB, or XDR-TB. This underscores the importance of early detection and comprehensive management to prevent further transmission and complications within communities.
Good morning, my name is Gregorius with last 3 digits of the number 35. Now I'm going to explain about the prognosis of MDR-TB. So the success rate of MDR-TB treatment is 56% globally and 48% in Indonesia. And the risk factors of MDR-TB vary among age, gender, body mass index, or BMI, treatment history, and underlying disease. And this affect the MDR-TB treatment prognosis. Other aspects, such as earlier detections of MDR-TB, could affect on treatment outcome. The therapy for MDR-TB should be done correctly. The shorter duration of effective MDR-TB treatment usually benefits the patients. However, incomplete therapy could increase tuberculosis survivability by niche presence that could reside on polymorphonuclear or PMN, and then transported again into tissue, and even worsening the disease. That's all from me, and thank you.
Okay, next Respiratory summary. Let me introduce myself first. My name is Karin with the last digit number 05. So for the conclusion, MDR-TB is characterized by resistance to first-line TB drugs driven by human error involving both primary and acquired resistance. The clinical symptoms mirror typical TB. They endure despite treatment, underscoring the importance of precise diagnosis via culture-based technique and the comprehensive treatment approach, DST, personalized regimens, and management stage. And for the suggestion, public education on recognizing TB-resistant symptoms and relevant risk factors should be prioritized, and further study by scientists and resources are important to gain more knowledge about MDR-TB. Okay, that's all from SGD 7. Thank you.